YouTube video tips number 2. As you treat, you are getting pretty good results. Then the treatment progress seems to have stopped. Consider that there may be more than one trigger points along the length of the muscle. For example, the sternocleidomastoid and the gracilis. Or there may be more than one trigger points in a big muscle, for example, the gluteus maximus. You may have only eradicated one trigger point. You need to treat all of them. Again, if you're getting good response and then the treatment progress appears to have stopped, consider that you may have eradicated a trigger point on a more superficial muscle layer, but there may be more trigger points in the deeper layer. For example, you may have eradicated a trigger point in the supraspinalis capitis, but there is another trigger point underneath it, in the suboccipital muscles. You may have to palpate deeper and look for trigger points in the deeper layer to treat further. Another example, you may have eradicated trigger points in the gluteus maximus, but there is a trigger point in the piriformis deep to it. You may have to palpate deeper and treat what is underneath. If the trigger points you are treating are eradicated, but the pain hasn't improved, maybe you are treating the wrong muscle. Explore and palpate other muscles close to the site of pain. For example, you thought that the trigger points in the supraspinatus is the cause of the shoulder pain, but in fact it is the infraspinatus. In another example, treating a plantar heel pain, trigger points in both the gastrocnemius and the soleus can be the cause. Muscles that are located laterally or medially, try both the J and K Somatotopes. If one somatotope doesn't work, try the other. For example, trigger points in the posterior aspects of the trapezius is in the K somatotope, whereas trigger points in the anterior aspect is in the J somatotope. In another example, trigger points in the adductor magnus may be in either J or K somatotopes. In any pain syndromes, myofascial trigger points can be part of the cause, and at times the main cause of the pain. The pain caused by trigger points can often mimic many different conditions. For example, pain caused by trigger points in the infraspinatus can mimic shoulder arthritis, rotator cuff diseases, bursitis, even cervical radiculopathies. Trigger points in many neck muscles can mimic migraines, different types of headaches, neck arthritis. Trigger points in the latissimus dorsi can certainly mimic C8 radiculopathy, breast pain, axillary pain, even angina. Pain caused by trigger points in the gracilis, quads, can mimic knee arthritis and meniscal tear. Trigger points in the soleus can mimic many causes of plantar heel pain, like plantar fasciitis or heel spur pain. Trigger points in the gluteal muscles and the piriformis can mimic lumbar radiculopathies, can also mimic arthritis in the lumbar spine, sacroiliac joint, or hip joint. In treating the J and K somatotope, acupuncture needles, dedicated laser, or laser pointers can be used. I have found that even a 1 milliwatt laser pointer can be effective. In using laser pointers, please check for the legality of possessing one and at what power, as it is different in different countries. While laser and laser pointers work, I find that acupuncture needles are more accurate, especially in treating trigger points in very small muscles. For example, trigger points in the suboccipital muscles, the many small trigger points in the sternocleidomastoid muscle. To improve your skill, you can practice on yourself. For example, if you find some trigger points in your trapezius after a bad night's sleep, treat yourself. Practice. Either use a tube acupuncture needle, a laser, or laser pointer. With a non-dominant hand, you can station one finger on the GV20 and palpate with another finger, as shown in the diagram. Fix the index finger on the GV20 and palpate with the middle finger in the J somatotope. Fix the middle finger on the GV20 and palpate with the index finger in the K somatotope. And use your dominant hand to either needle or laser. I have written and published a book about trigger points and this shortened version of YNSA. The book is called Common Pain Syndromes, A New Approach. It is available through my website, jocheung.com.au.